I'm Ricardo Colberg, sports medicine physician at Andrews Sports Medicine and Orthopedic Center in Birmingham, Alabama. Today we're going to be performing a percutaneous trigger finger release under ultrasound guidance. The benefit of this procedure is that it's minimally invasive and it only requires a needle to perform the release. That means that there is no incision or cutting of the skin and there is no need for sutures. Because of that, the recovery is much quicker. Typically, patients can return to activities in less than half the time it takes to recover from a surgical procedure. A patient will have a Band-Aid for the first 24 hours, and after that they can remove the Band-Aid. The patient can immediately start using the hand right after the procedure. We do recommend wearing a splint at night to keep the finger straight. After 2 weeks, the patient is cleared to resume all activities with full duties, including heavy gripping and pushing. With this procedure, we start off with cleaning the area and creating a sterile field. We're going to do a local anesthetic injection using lidocaine 1%. With ultrasound guidance, we identify the A1 pulley. We then proceed to advance a 20 gauge needle. You can see the needle with its lumen right through here and the two sides of the needle. And we advance that needle through the extent of the A1 pulley. You can see some of the fluid spreading over the A1 pulley and some of it under the A1 pulley towards the tendon sheath. At this point, we proceed to start the release by doing the percutaneous fenestration of the A1 pulley. Once the A1 pulley is completely released, we then recommend doing a cortisone injection into the tendon sheath to help treat the tenosynovitis that brought about the trigger finger. As mentioned, the patient will have a Band-Aid for the first 24 hours and wear a splint at night for the first 2 weeks. Otherwise, the patient is allowed to move his hand and use his hand for basic activities of daily living.